Hey, 8-bar corner pocket, calling all the shots, boy. Raw denim, 5 pockets, feeling like a hot boy. Y'all tripping, I was in the crib watching Top Boy. Chopping up this green, guess I got a thing for Bok Choy. Ain't worry about your playlist, bruh. I need an alias, I need a foreign passport, and a change of radius. I don't pay 'em, but I don't save 'em, I ain't the glaciers. Need 2 chains like Def Jam to change the glaciers. Titanic crash against flaws, you know my wave crazy. Put over with no ID, look like cocaine 80s. Same kid with stripes like a ref's average shirt. Got the next magic verse, got my chest tatted first. Treasures, Antioch stores make desperate measures. Back when you had a 1-up when your shirt said pleasures. Was in the church like elders, was underground like shelters. Made a plan to get it and kept it together like welders. I'm living stress-free, never catch me, never test me, oh no. I'm living stress-free, never catch me, never test me, oh no. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. Whoa, 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 whoa. All black leather now, my vibe much better now. My tribe said I'm the one, my time feel extra now. My instincts dialed in, my senses is dialed up. My sentences chime in, they eyebrows rise up. I feel like a titan writing the scripture. My might is touching the mixture, designing the holy picture. Reminisce on tradition, my fighting the heart with the knockout. Genesis definition of light when God told me pop out. With a smile on my face upon my arrival. It's a difference when racing for your survival. Think I'm poised to win it. Checker flags, waving Nipsey Honor. Drinking Chardonnay with my little mama banging Rihanna. Icons of this time that we live. I'm facing my every fear. I'm taking time to be still. I'm breaking down every barricade as I wait at the pier. Still waters run deep and I swear it's great to be here. I'm learning patience this year, chasing greatness this year. I'm making statements before they happen, creating this year. I seen love leave and I seen hatred appear. And my ears adjust to the silence, the snakes I can hear. But it's never scary. The DNA of God hereditary. We all in the same class, but the lessons vary. Old school ambition, but painted extra cherry. Receive the fruits of my labor, I think it's necessary. I'm living stress-free, never catch me, never test me, oh no. I'm living stress-free, never catch me, never test me, oh no. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. I wish you could see me now, I'm unstoppable. Whoa, 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 whoa. Whoa, 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 whoa. Whoa, 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 whoa.
I seen the light, 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 light. I see the reason in the night, 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 night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. Yeah, my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back? Yeah, my heart gets cold, I need you when the lights go low. No love wasted, if you take it. If you feel a little lonely, I could use a little something. We could make a new beginning. Feel a little lonely, I could use a little something. Don't give me up, I seen the light, 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 light. I see the reason in the night, 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 night. And every time I close my eyes, guess I just need you by my side. Yeah, my heart gets cold, I need you when the lights go low. Yeah, my heart gets cold, I need you more than you know. After all the time that's passed, is it wrong to say I want you back?
Hurt people, but we might have took it too far. Don't ever question if it's love, you know I got you if you do call. It's so much easier to run with the traumas wherever you are. Can't afford to point the finger, should probably tend to my own flaws. God, with what little pride I can salvage, I'll just pick up and go. Trying to sing to your heart, you went straight for the throat. Know you fronted the bill, but now we divvy the quote. That's time spent with nothing to show. Hard to stomach, I know. Manipulation we didn't need to deploy. But you playing with my vision like you think it's a toy. A product of pain, your demons bleed through the noise. Nothing but a host you sent to seek and destroy. Just a reminder to clear your mind up. This ain't no size up and not a fair fight. Neither the bodies start to pile up. Let's put that behind us. No.
Good afternoon, everyone. We will be starting shortly. We'll just give everyone else some time to settle in. There's still people trying to log in, as I can see them in our Zoom, and some are in our Facebook live page. So let's give them a few more seconds to settle in, and we'll be starting right after. Sorry. All right, good afternoon, everyone. Welcome to our live webinar on how to immigrate to Canada as a healthcare assistant, or some people would say healthcare aide, or some people know this one as personal support worker. But yeah, so the question is how to immigrate to Canada as a healthcare aid assistant. My name is Israel Roman, and I'll be your host for today. I am a licensed immigration consultant. And again, welcome everyone. So as I've said, I am a licensed Canadian immigration consultant, and at the same time, a registered nurse here in Canada. And we have our offices. Our main office is here in Nanaimo, British Columbia, and our Philippine office is located in Lipa City, Batangas. So before we continue on, I just want to give you guys a quick information on my credentials so that you guys are very much aware, or you guys would know like who is the person talking right now. Okay, so I am as I've said, I am a licensed Canadian immigration consultant, and I am registered with the Immigration Consultant of Canada Regulatory Council, or we call this one ICCRC. So in order for me, in order for any person, anyone to be able to provide immigration services or immigration consultancy, we have to be registered with our governing body. So this would be almost the same as if you guys are registered nurse back home, you guys are registered or you have your license with PRC, right? So it would be the same thing. So anyone that gives any advice, whether this is for free or not, they need to be licensed with ICCRC. The only time that they don't need to be registered with ICCRC is if they are your relative giving you advice. And our office, our company is registered here in BC, Canada. And you guys can go ahead and search this one if you guys would like to. And just simply go to the Canada Business Registry and just type in Roman and Associates Immigration Services, and you'll see in there our license or our business permit. And also, you guys can also, you guys can go to to any search engines out there like google.com and just search for my name, again, Israel Roman, to just make sure that I am truly here in Canada. What I'm saying is truly for real, right? So, and of course, I I'm pretty sure there are some people out there doubting, right? That this might there's a lot of people out there that are scamming other people, and that is totally and that's why I would like you guys to make sure to search for my name for our business, because I want to make sure that you guys feel confident that we are a genuine company and a licensed company as well. So, very interesting topic. So, how working as a healthcare assistant in Canada. So, in order for you to work as a healthcare assistant or a personal support worker or a home support worker, you need to be registered with the health worker registry. Okay, and let's say for BC, you need to be registered with BC Care Aid and Community Health Worker Registry. Okay, you won't be able to work as a healthcare aide or as a personal support worker by just simply applying or just simply look for an employer and come here and work. No, unfortunately, you'll have to register first with the health worker registry, right? And it's almost the same thing as me being licensed with ICCRC or you guys being licensed with PRC for your nursing. It would be the same thing with the care aides, with the support worker. They need to be registered with a health worker registry. Now, the challenge with that one is that internationally educated healthcare professionals like yourself, right? You need to be residing in BC or residing here in Canada before you can apply for such registration, right? So with this one, then this one would kind of like tell you guys that it's impossible while you are outside of Canada. It's impossible for you guys to come here and work as a care aide because you won't be able to get registered. You won't be able to register no matter what you do. While you're outside of Canada, you won't be able to register. So unfortunately, you won't be able. Unfortunately, there's no coming here directly to work. It's not an option. But we have other ways on how we can help you come here and be a healthcare assistant, knowing that this one right here doesn't help you guys, right? Before I continue on, so just make sure if you have any questions, please do not hesitate to please enter them in our chat box or in our Q&A chat box, okay? Or Q&A portion or Q&A section, sorry. So what is the best option for you if you are a nurse outside of Canada or you have some education around healthcare aid or personal support worker? How can you come here and end up working as a healthcare aid or healthcare assistant? So the best option really is going through our education partner, Stenberg College and Roman and Associates. This would be your gateway to come to Canada as a healthcare assistant. And I'll give you a higher overview in this one, and then Mom Janica from Stenberg will also explain further what the course entails. So what you'll have to do is apply for a study permit, okay? And what you'll be studying would be the healthcare assistant course. And again, this one would be provided by our great college partner here, Stenberg. Then what, right? So once you have studied the healthcare assistant course, then what? So soon after you finish your course, then you have options. You can either apply for a work permit with LMIA or Labor Market Impact Assessment. Okay, so that's one option. The other option is you can apply for your permanent residency under the Caregiver Pathway Program. That's another option for you once you have completed your HCA course. Or you may want to continue your study program, right? And it's either you can, if you are a nurse, then you might want to maybe you after your course, after hearing how great the postgraduate diploma in Canadian nursing is that Stenberg also provides, you might want to just pursue this one, right? Or you might want to pursue other courses that Stenberg College offers, like early childhood education. And there's other courses that Stenberg College do offer that you might want to continue on, right? Another one is the pharmacy technician, right? So again, once you have completed your HCA course, you have options. There are multiple options for you in order for you to stay here in Canada. And Mom Janica would explain further what are the benefits of studying the HCA. Right? So I'll give you guys a quick overview. Okay, study permit is would be a big investment, right? It's an investment, but I see this investment as I see it as an investment for yourself, right? And the return of investment will be you have control over how quick you'll get your investment back. So if you're already here and working as an HCA, what would your hourly rate would be? Okay, so this is an example of job posting that I just cropped earlier. So as you can see on the box right there, salary range would be 25.83. So this is in the hospital that right now I'm working with, right? So it says that close date May 27. So we can see that it is a current job posting, and there's a lot of other job posting for patient service aid, which is also the same as healthcare aid or personal support worker. So the hourly range is $25.83. If we translate that, if we do a sample computation on that wage, how much would it be? So $25.83 times 40 hours per week. This one will give you $1,033 per week. Okay. And in a month, that would give you $4,000. And in a year, that would give you 53,726. If we convert that one to Philippine peso, that would give you 1.8 million per year, right? And this is working as a healthcare aide or healthcare assistant or personal service aide. Okay. One question I have for you guys is, and probably you are a nurse back home right now. My question is, would you be earning close to 1.8 million per year as a nurse working in the hospital looking after 20, 30 patients per shift? And I'm confident that your answer would be a no, because I've been there. I've also practiced as a nurse in the Philippines, and this is yeah, there's no way that I would be earning 1.8 in a year as a nurse. Okay, so another occupation that you can work after you have completed your course could be a in-home caregiver, right? So the other one, the healthcare assistant, you might be, that one would be for a, let's say, a long-term care facility or in a hospital. This one, in-home caregiver, would be like looking after an elderly, right, in a private home. So this is the prevailing wage in Canada as of right now, right? So in Canada, the median wage is 16.85. If you'll be working in Alberta, it is 18.65. British Columbia, that is 19.56, right? And then the Northwest Territories, that is $21, but I would not recommend you guys to work in the Northwest Territories because that is all the way up where Santa Claus is. And so yeah, so that's where the snow is. And there's sun throughout 24/7 or there's no sun 24/7. So there you go. So I won't advise to work in Northwest, but other places, of course. So let's do another sample computation as a in-home caregiver. And just using the median wage, 16.85 per hour. So that would give you 674 per week. In a month, that would give you $2,000 or 2,600. In a month, in a year, that would give you 35,000. Okay. It's lower than the healthcare aid, but still, that would be 1.2 million. All right. So same question as earlier. As a nurse, do you think you'll be earning? Do you think you can earn 1.2 million? Right. Probably you may. I'm not sure right now if you may, but looking at the workload though, like an in-home caregiver, this 1.2 is looking after 1 or 2 elderly people, while you as a nurse, for sure, you are looking after at least 10 patients, right? So yeah. So what are the advantages in joining with us, with Roman and Associates? So first is, of course, our partnership with the college that delivers exceptional education, which is Stenberg College. We have a reasonable administration fee for this. Then our professional or consultant's fee is waived. Okay, so for when you guys hire us as your immigration consultant, the fee will be waived just because of this webinar. Okay. if there are, if you are bringing your spouse or dependents, right, there won't be additional fee for that one. I mean, like, there won't be any additional professional fee for that. Normally, there will be, like, if you have a spouse, there's additional fee. If you have children, there's additional fee for that one, because that's additional work, right? So, or additional paperwork, additional documents, additional things that we have to, it adds up in terms of the time spent to your application. And there won't be any IELTS, right? So this one will be waived, and Mom Janica would kind of like explain this one further. Job security. So soon after you complete your course, there is a job, right? And again, Mom Janica will kind of like explain this one further on how, right? And as I've shown earlier, multiple options to stay in Canada post-study. So you don't need to go back home after studying the healthcare assistant course. Okay. So once again, with Stenberg College and our consultancy firm, this is your gateway to immigrating to Canada. And with this, I'll hand over the webinar, the hosting, to Mom Janica.
Hello, good afternoon, Sir Israel. Thank you so much for giving us this information. Very, very helpful. Thank you. Okay, so hello, everyone. My name is Jenica, and I am the Director for International Admissions and Recruitment for Southeast Asia at Stenberg College. So I am also based here in the Philippines. I know Sir Israel is based in British Columbia. I am here in the Philippines. I am working from home, so I apologize if there's any background noise. Okay, so let me continue on with the presentation. I know you're excited to know about the program that we are offering. So I'm just gonna share my screen as well. Okay. So for today, we're going to discuss the Healthcare Assistant Diploma Program and how you can enter this program through us. But let me just show you a very quick video. Okay, this is the Stenberg College introductory video. Please enjoy. Okay, so now Let me introduce to you our institution. So Stenberg College is a well-known medical college in Surrey, British Columbia. We've been around for over 30 years now. We're a private post-secondary college. And when we were founded by Mary Jane Stenberg back in 1990, we've done so well with the outcome. Yung mga graduates namin, they we had 100% passing rate. It was such a good first few years that we got acquired by Tech Global. So Stenberg College is under the management of Tech Global, which is the education company. And we have a sister school. The sister school is Center for Arts and Technology. So, but for today, we're just going to focus on Stenberg College. Now, our programs are really mainly focused on healthcare programs, but we've also extended our programs into different industries such as education, business, and human services. For today, again, we'll be focusing on the healthcare assistant program. Our location is in downtown Surrey. So for those of you who are not aware, Surrey is a suburb of Vancouver. So we're just about 40-minute train ride away from Vancouver downtown. What's good about living in Surrey though is that it has a lower cost of living compared to Vancouver downtown. Our campus is also right in front of the Central SkyTrain station. There are bus stations in front, so it's a very accessible location. We this is something we're really proud of. We pride ourselves with our very strong employer and industry relationship, and I'll tell you more about that later on. And we also have online learning available. So when you become part of Stenberg College, one of the I think key differences that really sets us apart from the other private colleges and the other public colleges is that we are very keen about the student success. We really focus on students, not just their success on the academic level, but also we make sure that they are successful with their employment. And then for those who would like to continue on with permanent residency in the future, we also support that. So it's a holistic support. And not we really try to have smaller classes. We try to have a very conducive learning environment for the students, very interactive, and we have a lot of support that the students can get from us. So some of those support would be the student services. I think that's your main, that would be your number one department who would be talking to you after myself. They are called the student success coordinators. So they will be helping you out. We also have career services. Now, with the career services, just because we do placements, it doesn't mean that we will not train you on how to get a job as well. So part of it is to train you, to educate you on how to create proper resumes, how to handle interviews, because you will still be using that in the future. We also have academic support because we understand that international students may need to adapt to a new type of learning. So let me just give you an example of this. I would assume we are all Filipinos here. Here in the Philippines, right? When we were back in our college days, we would have probably an average of 3, 4 subjects in a day, right? And that would mean we're going to shift our learning brains from one subject to another in maybe after every couple of hours. And we have all of these books when we go to our school. Now, in Canada, there is what you call a focused learning. Okay, focused learning. So it is when you have to complete one subject first. And that one subject can last you maybe about 3 weeks or so. And once you complete that subject, that's the only time that you move to the next subject. So it's called focused learning. Now, that might actually be different from what we're used to. And so we understand that some students may need to adapt, and if there is a need for students to do one-on-one sessions or maybe additional sessions, because we do free sessions for students, we will be providing that to make sure that you would pass your subjects. We also have immigration consultation support on campus. So apart from Roman, I would suggest that you go straight to Sir Israel's team if you have any questions, okay, about your immigration questions. So one of the things that we do, we partner with legit agencies only. Those like with Sir Roman and his team, we make sure that we partner with agencies that have very good track record, that we know our students will be well supported. Now, with our employment, part of your program, you will already have a co-op. So co-op means cooperative work experience. So here in the Philippines, it's more commonly known as internship. Okay, so you will be placed with an employer, and I say placed because you're not going to have to look for it. There's no need for you to look for it because we have the employers already. So we will just place you with the employer, and you will be completing an X number of hours as part of your curriculum, and you will be working there for about 20 hours per week. You will get paid during this co-op period. So not only will you be learning, but you will also be earning. We have accommodation assistance on campus. So the campus itself does not have a dorm, okay, because you're in the city center. So we don't have a dorm. But what we do, some students, they would like to do homestays. So homestay is when a family would be hosting you. You'll be living there. And that is a really good way to immerse yourself into the culture, to learn the language some more. I know Filipinos are very well versed, very high competency when it comes to English, but when we're already there and using it on a daily, then it would definitely enhance our communication skills some more. Now, some students, they would like to be introduced to their classmates simply because they want to do arrangement on shared accommodation, and that one we can also facilitate. Okay, so now that you know who we are, let's talk about the medical programs. Actually, I will be focusing only on healthcare assistant diploma program, although we also have a postgraduate diploma in Canadian nursing, which we discussed 2 weeks ago with the Sir Roman's team. So if you want to know more about that, please reach out to them. I'll just give you a bit of an overview of it. So for the healthcare assistant diploma, I think Sir Roman already explained the role very well. So I'll just give you a bit of a review. Basically, they're the frontline care providers, okay? And it is not limiting to just caring for the elders. I think that's that's a misconception here in the Philippines, that if you're a healthcare assistant, healthcare aide, personal support worker, caregiver, you're just working with the elder care. It's not just that. You can actually work in different community settings, such as, of course, the home support agencies, residential care facilities, but you can also be caring for children. You can be working in hospitals and maybe assisting there. So it's not limited to just caring for the elders. Now, when you enroll into a program in Canada, especially in British Columbia, your program needs to be an accredited program, okay, by the BC Healthcare Registry. Because that way, if your program is credited, then that means that you can continue on and work as an HCA. So just to give you a bit of the information on the occupation demand, right now, we have a lot of HCA staff as well who are teaching on campus in our school. And some of them teaching, some of them work with us part-time, but their main work are, with their healthcare assistants as well. And one of the things that they would always tell me almost daily is that, Jenica, we need to have more healthcare practitioners. We really are in need. So this is not just by 2024. This high demand is happening right now. So this is the perfect time for you to really jump on that bandwagon and get yourself a new life in Canada. So in general, these are just some of the things, some of the duties that healthcare aid does. You can take care of the elder. You have to serve meals, measure blood pressure, supply empty bedpans, give medicine, first aid in emergencies. So these are just general duties. And I think it was already advised by Sir Israel earlier, addressed by Sir Israel. The average salary, yes, this is just, I'm actually giving you the lower per hour rate here because as you can see, it's already at 25 and some employers even offer up to 27 per hour because that's how in demand the profession is. So for almost 30 years, we've been providing healthcare aid graduates, okay, to these employers. So what we do, they are our co-op partners. That means that for the co-op part of your program, we will be placing you at these employers. And what normally happens is they get absorbed. For HCAs, we have a 100% employment rate. The job has never been a problem for us. So these are just some employers. You can check them out to see, what they would look like. Okay. And with the program itself, let me just focus on this now. The program itself is a diploma program. Your study hours will be around 20 to 25 hours per week, and your co-op will be at 20 hours per week. Aside from the diploma that you will be getting from us, we have incorporated different certificates into the program. So some of them you will have to complete online, some of them you'll have to complete face-to-face. So it's already part of your whole program. And the reason that we've added a lot of other certificates is that it complements your profession. Okay, again, we want to make sure, that you're not just getting the most basic information. We want to make sure that you are, holistic, successful academically and with your employment. So this is just an example of, the courses that you'll take. So by the way, you might get confused with the terminologies. When we say course, it just means subjects. Okay, because here in the Philippines, we say, what's your course? BSN, right? But in Canada, the terminology is, what's your program? I'm studying healthcare aid diploma. Okay, what course are you studying now? So that just means subject. Now with this program, it's 1 year and 2 months in duration. Okay, 1 year and 2 months. And within that 1 year and 2 months, you will have 6 months of paid co-op. So basically, you're going to do the academic part for only just 8 months. And then the rest, you'll be working. You'll be putting into practice what you've learned and you're getting paid for that. The intake for this program starts on October 12, and then our next intake for next year is March 2022. Entry requirement is just year 12. So year 12 meaning if you've graduated K-12, you're from the new curriculum, you have a direct entry to this program. If you're from the old curriculum, like me, grade 10, high school, 4-year high school, and then 4 years of college, right? But if you're an undergraduate, that's fine. As long as you have completed your 2nd year of college. And I say completed, okay? Because that would mean year 12 equivalency. Now, if you've completed BSN, you've completed a bachelor's degree, that is no problem as well. That you will just be considered a mature student and you will still be accepted into the program. For the English requirement, I know we said waived IELTS, but if you already have one, I highly recommend that, if you're not afraid to take it already, go ahead and do that. We just require general. If you have academic, that's good. If you have general, that's good. It's overall of 6.0, no band lower than 5.5. Now, for Filipino citizens only, we will waive your IELTS to enter the program. So you can enroll with us without your IELTS. You just need to submit a medium of instruction. Now, there is a terms and condition for those who will want their IELTS waived. If you want your IELTS waived, you will still need to have an English exam done when you arrive on campus. It can either be when you arrive or when you're about to start the program or when you're starting the program or before you arrive. Why is it needed? Because this program is regulated, right? You will be registered into the BC Healthcare Aid Registry. And BC Healthcare Aid requires an English requirement. Okay, so you can enter our program, we can waive your IELTS, but then eventually you can just do that when you arrive there in Canada. Now, for the tuition fee, as you can see, I think you've already seen it. You can take a screenshot. The Healthcare Diploma International for the full duration is just 15,860. So that's already for the full duration. It already includes the student fees, the books, the materials, the equipments, the co-op fees. That's already for the full duration. There's no add-on to that. Now, with the initial deposit, for you to enroll into the program, you just need to pay 5,150 Canadian dollars, and you can get a letter of acceptance from us. Now, that 5,150 is deductible from the total. And of course, if your visa result is not favorable and you don't want to continue, it will be refunded. There will just be a processing fee that will be deducted. But I am confident that if you go through the application with Sir Israel's team, I am not even thinking about any refusal, because I'm confident that they will be able to bring your student visa approval. Just continue to follow their instructions. Now, if you apply through Roman and Associates, we will be waiving your registration fee as well. Registration fee is part of the total fee. So that is worth 400 Canadian dollars. So we're going to remove that and we'll be crediting it to your account. So your total will now just be 15,400. So I mentioned earlier, we are a private institution. What does that mean for you? It means there will be no PGWP. Okay, I will repeat that. There's no PGWP. We are not afraid to say that to you. Why? Because we do not need it for this program. Okay, so with us, the transition is from student visa to work visa. So how does that happen? Because our employers provide the work sponsorship for our students. Now, this is the best thing. If in case, and this has never happened, but if in case we have a plan B in place, what if you do not get, you're the very first HCA graduate who do not get a work sponsorship? What happens to you? Will you be sent home? The answer there is no. If you want to stay back, we do have an option. Because we have partner employers, we can provide you with a temporary work visa under LMIA. And under that temporary work visa, we will be pursuing long-term work sponsorships for you. This has never been used, again, because we've never actually had a problem with students getting employment after the completion of the program. So we can guarantee that there will be work afterwards. So again, the transition is student visa to work visa. And then eventually, if you want to do your permanent residency application, you can do that as well. Because healthcare assistants, caregivers, and as far as I know, the government is opening up new pathways for healthcare practitioners to have better immigration pathways. So I think this is the best time for you to start your HCA journey so that by the time that the government opens up more immigration pathways for you, you will be eligible for that. So the admission process goes like this. You submit your application to Roman and Associates. And they will be reviewing all of those. They will send it to us. And when we're happy with your documents all complete, we can give you a letter offer within 24 to 48 hours. Once you have the letter offer, you can already make your initial deposit payment. And once you pay, and once that payment clears, you will be getting your enrollment documents. You will have to sign them, send them back to us, and we will give you your letter of acceptance. Letter of acceptance, or the LOA, that is what you use to apply for your student visa. And lastly, I would just want to touch on this COVID 19 issue. So, with the COVID 19 readiness plan, we are an approved DLI. So, that means that you can definitely travel. Actually, we've received this week alone, we've received a couple more student visa approvals. So, that is really good. And some of them are arriving by next week. So for those students who will be arriving, definitely they can travel because we're an approved DLI, and we can arrange the airport pickup and transfer for you. If your hotel isn't going to do that, we can do that for you. And for our newly arrived students, we take care of their groceries, their food during the 14-day quarantine, because we believe that, they've spent a little extra on the hotel. So we want to alleviate that financial burden for them. So we take care of their meals during their quarantine period. I'm not going to play this video anymore. Okay, so just in summary, again, Stenberg College has been in the industry, healthcare industry in particular, for over 30 years now. We have an outstanding support services to our students and graduates. We have industry partnerships with 98% employment rate, and then for HCAs, for opticians, so those are 100% employment rates. Paid co-op, practicum, placement services, immigration pathway, COVID-19 is there, the readiness plan is there. We have a very affordable tuition fee as well. And we encourage you to really do your research, and you will see that we are a really affordable school to enter for healthcare assistant program. So thank you so much for listening. I really appreciate your time. If you can just go ahead and visit our Facebook page as well, hit like and follow, because we do announce if there are any updates for discounts, scholarships. So we do announce it on our Facebook page. So thank you very much for listening. So there you have it, sir. That is the end of my presentation. So I think we can go ahead with the Q&A.
Yes, thank you, Ma'am Jenica. That was again very, very informative presentation. And yeah, so I'm hoping that all of our participants right now or attendees have learned a lot of things. And I just want to attest that in terms of the employment, we're in yes, as a healthcare aide, you can definitely work in a hospital setting as well. So I have multiple hats. I'm an immigration consultant, and my other hat is I'm a nurse manager for the cardiology floor here in Nanaimo Hospital. So I do hire nurses like LPN, RNs, and healthcare aides. So it's every day. Every day there are always overtime shifts for nurses, for healthcare aides. So it's normal. I mean, like, it's sad to say, but it's normal for healthcare aides here to work double shifts. So 16 hours. So the first 8 hours would be straight time, $23. Then the next 8 hours would be double time, right? So it's 23 times 2. And yeah, and it's and that's because there's a lot of shortages of healthcare aides, not just here in the Vancouver Island, but it's province of BC for sure. So yeah. So yeah, you guys are just in the good time to kind of like start this new career here in Canada. So let me check now our chat box. Hello everyone, may I ask what is suitable with me? I am a registered pharmacist and currently taking caregiver course. now. So what? Okay. So with this one, yeah. So there are multiple. I'm pretty sure there are multiple courses that would be applicable for your situation. So what I would recommend is please go ahead and just submit your resume to us, and we will go ahead and take a look at that closely and let you know what your options are, and then from there you can definitely choose. And I'm just typing in the email. Did I go? Yeah. So just email it to assessment@romancis.ca, please. Okay. Next one is I have an IELTS. Shall I no longer be required to submit the requirement? Mom Jenica?
Yeah, so if you already have an IELTS and you meet 6.0 overall, then you just need to submit the rest of the requirements.
What?
The rest of the requirements would normally be, your identification, which is your passport copy, academic records like your transcript and your diploma to show that you are of year 12 equivalency, and then mostly resume, your IELTS, and basically that those are all the documents that we need. We just have an online application form as well, which you can get from Roman and Associates. So I think better to submit again your resume to them first so that they can give you all of the other information. But since you have IELTS, that's really good. You don't have to retake it.
Thank you, Mom Jenica. And maybe you can answer also, Mom Jenica. The next one is what was that? How many days do we report in school?
So that would really depend. Normally for the orientation part, which lasts for your first a week or first 2 weeks, normally you go to school for 5 days part time, like 5 days, just 4 hours, right? Because the total number of hours study time is just around 20 to 25 hours per week. So it's just a part-time type of study. And then when you start the core program, it really depends on which cohort you fall into, because we don't have just one cohort, means like a section. So it can be like maybe you'll be going to the campus for maybe 2 days in a week, 2 to 3 days in a week. Okay, and then the rest are flexible because it's self-directed learning. So it really depends on what schedule you fall under. But again, it's just going to be 20 to 25 hours per week, which will allow you to still work part-time.
So yeah, so Mom Jenica mentioned, yeah, so you guys can still work part-time. So while you are in school, taking that 20 to 25 hours per week, you'll be able to also work part-time, like 20 hours per week. And with that one, just because you're a student doesn't mean that your salary as a working student would be lower than the rest of the people here in BC. No, you will, if you are working as a working student, your wage would be at least the province minimum wage. So you won't be earning lower than the BC minimum wage. So yeah, and that would be a great help for sure, right? If you need it. But yeah. And next is, so the total in pesos. So right now, I mean, like I don't know what the rate right now is, but I just kind of like calculated it at 35 pesos per dollar. So 15,000 Canadian dollars times 35. So that would give you 525,000 pesos. But again, yes, it may sound a lot. Of course, 525,000 is a lot, but if you can recall the presentation as well, that is only, I mean, like you can get that one in 6 months, right? For
Yes.
working here in 6 months, you already you'll have your investment back in your pocket, right? So, and yeah,
Can I just add, Sir Israel, because we actually did a calculation in that, because during their co-op period, and that's 6 months, right? That's 6 months of co-op, you're working 20 hours per week under your co-op. And since that's part of the curriculum, you can still work an additional 20 hours using your study permit. So that should give you around 40 hours of working time for 6 months before you complete the program. You can get your money back. So again, I think Sir Israel explained earlier that studying is an investment. It is an investment, but we can guarantee you you'll get your money back straight away. I just want to do a quick shout out to Jeff and Kay. I miss you guys. Hello. Those are my team members when I was managing an operations floor in my past life. Hello, and you're watching. I hope you sign up with Sir Roman and Associates.
All right. So, all right. So next question is, how about the accommodation? Should we pay for it?
Yes, yes. That is not part of your tuition fee. So the cost that I shared with you is just the tuition fee cost. So if you want to, for us to facilitate, introducing you, endorsing you to homestay partners, and introducing you to future classmates, we can do that, and you can save accommodation that way.
Yes, and I mean, I don't think there's any school that provides free accommodation as well. So that is a very standard practice wherein the accommodation is shouldered by the student. The only difference is that here in BC, our cost of living is lower than the other province or the other city. So rental would be lesser than the other province for sure.
Let me just share, Sir Israel, because like one of our admin person, she shares with other students, and her average cost per month would be around 350 per month. So it's a bit low. But if you want to have your own, like if you want to rent your own room, it can go as high as about 800 per month or maybe up to 1,000. But if you're a student, you're starting off, I would recommend that you do some homestay or maybe sharing your accommodation so that you can have a lower accommodation rate.
Okay, so next question is, hi, good afternoon. May I know if there's any job for me as a caregiver? I'm a nursing graduate, underboard, and currently I am an EMT rescue medic at 911. So great on you for your job. I know that's a very stressful job, the 911. But unfortunately, yeah, I mean, direct answer is no. We don't have. It's going to be hard for us to give you work as a caregiver, and that is why we Stenberg College have kind of come up with a strategy on how to help you guys come here by using the not using but with the study program, right? So that's why the study program is the way it is right now. It's like 6 months of school and then the co-op thing, right? So that's where you'll get your employer. So it's from the school, from your study program. Next question is, I attended the previous webinar. I am a postgrad diploma on nursing. The first part of the study is HCA and will be taken for about 5 months only. But this one is 1 year and 2 months.
Let me answer that. Okay, so we have a program called Postgraduate Diploma in Canadian Nursing, and it is really for registered nurses who have a minimum of 2 years work experience, right? Now, what we did with that program, it's a 2-year program. We've embedded an HCA diploma into it, and we did a fast track version. Because if you think about it, the HCA academic part is just 8 months. So we did a fast track and made it into just 5 months, and then we incorporated it into the postgrad diploma on nursing. Now this 1 year 2 months that we're offering you is just a standalone healthcare aid diploma program, which has 8 months, which is the regular delivery of the actual program, and then we added 6 months of co-op. I'm telling you, you will need your co-op. You will need your co-op because you're an international student and you won't immediately have, a job after, that 8 months. And it wouldn't really look good on your visa if you apply for an 8 month program. So this is a 1 year 2 months. It will have 6 months of co-op in it. And then the HCA academic delivery part is, instead of 5 months, it's 8 months, because that's the normal delivery of the HCA. So the previous webinar that we did, again, is for registered nurses with minimum of 2 years work experience. Now, if you are on that profile, I suggest you go for that postgraduate diploma on nursing. But if you're an board, or you don't have work experience as a nurse and you graduated BSN, then I can tell you, go for the healthcare aid diploma, because you will still eventually have an access to becoming a nurse. And there are a lot of other programs you can enter after if you don't want to work. But work will always be there after the completion of this program. I hope that's clear to you, Sheena. Thank you.
Next question, mommy, is she has an IELTS exam, but it's already expired. Will the school accept that one or still consider it?
You can submit it, but we will, because we can waive the IELTS, so it's fine. But you will still need to take an IELTS test when you arrive in Canada. Again, it's not the school's requirement per se. It's actually the BC Healthcare Aids requirement. It's not ours. So we can accept your expired IELTS just to enter the program. Okay, there's no need for you to retake it, but if you want to, you can. And then you just need to take general IELTS when you arrive in Canada.
Thank you. And then next question is, what if I cannot get that amount? Is there any possible or other options, please? It could be help, ma'am, sir. Thank you so much. So yeah, so unfortunately, we don't have any way of like grants or scholarship to provide you guys. I mean, like if we do, that is if we only have a way, of course, definitely we would do it. But unfortunately, yeah, we don't have any means. The only thing that Stenberg College can provide is that they have a very, very reasonable tuition fee. If you guys compare that one to other school and compare the tuition fee, you'll see that the tuition fee that Stenberg has is way lower, or it's way reasonable than the other schools. So yeah. Next is, the school helped me finding a part-time job while studying.
Yes, actually we do. We hold, well, right now the career fairs look different, and then we normally provide them with the links of those that are looking for jobs. I can tell you, Karen, one of our admin persons, her name is Karen as well. Her name is Karen. She just submitted, she was going to transfer to a different hospital. She submitted a resume, let's just say today. The next day she has an offer. That's how quick, you can get a job for the HCA. It is really in demand. But we do, if you don't know where to start, the school helps. So you don't have to worry about that.
Yeah, like right now is it's an employee market, right? So employers are really begging, looking for employees at the moment. So it's kind of like just hiring everyone. So
Yes.
yeah, you won't have any problem with that one. And the next question is, There you go. Just clarification. So we can work at the co-op for 20 hours and still we can work outside on a part-time for 20 hours. And that is correct. The 20 hours for your co-op, that is for your school requirement. And then as because you have a study permit, with that one, you are allowed to work 20 hours. So yeah, so in total, you'll have 40 hours of work. Thank you, sir, for answering questions. Looking forward to enroll at the program. Thank you so much. Yep. Hoping to see your resume for sure. May I now ask how much is the expenses? Thank you. So with regard to the other expenses, I mean, just go ahead and email us your resume at assessment@romancis.ca, and we'll talk about the other expenses for sure. Do we need a show money in applying a visa? Yes. So one is that you need to be able to show that you are able to pay the tuition fee. That's one. The other one is the living expense. So that is sometimes the what people know as the show money. So living expense. So the immigration, the government of Canada would like to make sure that while you are here in Canada studying the program, you are still able to rent a space, eat your meals every day, right? So those types of things, and you won't be asking for money from the government, right? So they need to see that one. Right now, if you guys look at the website, what they'll say is that show money or living expense of 12,000 Canadian dollars per year. But what we suggest our applicants is that at least you need to have between 14,000 to 15,000. Right? It's better to have more than just enough, just for the so that we can really convince the immigration officer that you have the means, right? That you won't, that it won't be a problem for you. And next question, is there a possibility we get offered a LMIA work permit while studying or while in co-op?
Yes.
Yes.
Yes. Yes. You know, I can understand, Sir Israel, because Filipinos are quite apprehensive, but what's happening there is so different. LMIAs are being offered even before the students graduate. That's what's happening right now. So yes, there is that possibility. It's not even a possibility at this moment, which is why we highly encourage everyone. If this is what you want, do it now. Don't waste time, because while the market is hot, while the employers are begging for employees, this is the perfect time for you to be showered with offers. Actually, that's what's going to happen with you.
Perfect. So next question is, how many years should I stay in Canada after I graduated HCA, then apply for work permit or in any option? How many years validity of my permit in Canada? So I'm guessing the question is, after you graduate, how many years would you stay here in Canada and then get your work permit? But I'll answer it in this way then. So as soon as, I mean, like even before you finish your course, you might be able to get your job offer, right? So, and then while you're still in your course, you can go ahead and apply for your work permit, so that after your study permit, once you have completed your course, all of your requirement, you jump from your study permit to a work permit. So it could be, there might be no gap at all, right? So from study permit today, and then tomorrow you have your work permit. So I'm hoping that I answered your question. In terms of the validity, it depends. Sometimes it's 1 year, sometimes it's 2 years, 3 years, it depends. But for sure, it will not go beyond the validity of your passport. So if when you apply for your work permit and your passport expires in 6 months, your work permit expires in 6 months. right? So it will never go beyond your expiration of your passport. So, but that won't be a problem as well. It would just be more work for us. I mean, like you and myself, in terms of we have to reapply, right? So you have to apply for your passport here, renew your passport here, and then we have to reapply for your work permit and extension. Say, hey, here's my new passport with a new expiration date. Then there you go. Okay. Next is, can I ask, please, is there opening for nanny position? So yeah, so none really. It's hard for the nanny or caregiver position, right? So, but then once you are in the program, as Ma'am Jenica did mention earlier, they have already employers lined up, but the employers lined up are it only works for the co-op program, right? And then after your study, it doesn't work. It doesn't work in a way that they would directly hire you while you're still outside of Canada, right? So unfortunately, is the show money should be in our account name or could be a way of sponsorship? Great question. So yeah, so the biggest difference between the US and here is that in the US, you have the money should be in your own account. In Canada, it doesn't need to be in your own account. You can have a, let's say your parents are sponsoring you or your relatives are sponsoring you, then we would be showing, we would be asking for their financial statements and not your financial statements, right? Whoever is sponsoring you for your education, that's the person's financial statement will be asked for. I mean, so we have clients wherein their sponsors are also here. So so with that one, the letter of sponsorship would be, hey, I'm sponsoring my niece for education, and I'll take care of the room and board. She has nothing to worry about when it comes to the room and board. So yeah, so that one would work just fine. Hi, Sir Roman. Can I ask, is your office? Okay. I'm not sure what the question is, but our office is, we have our main office is here in Nanaimo, BC, and then our Philippine office is located in Lipa City, Batangas. It's in JP Laurel Highway, right? But I mean, like if you're far from our office, you don't need to travel, right? I mean, like in this time, I mean, like it's we can work via Skype, via Zoom, via, there's other ways that we can make things work without you traveling away too far, right? So yeah, but then of course, if you want to visit us, you're close, or if you really want to visit that, that's fine. Yeah, we are in JP Laurel Highway, Lipa City, Batangas. You're welcome. How much if my husband is with me? Then someone sponsor him in Canada, then apply PR. Then I'm still studying. Can I stop my studies and work as an open work permit? All right, Karen, I would suggest contact us directly on your question, because I just want to make sure that I am answering it correctly and as accurately as possible, right? So, Karen, if you can just contact us directly, Facebook business page, Messenger, we'll be happy to answer your questions for sure. All right. Next question is,
There is a
go ahead.
there's a question in the Q&A portion. I think it was questions earlier.
Okay.
The box.
Like this study, they pay later. How I wish I can apply. Yeah, sorry. Unfortunately, yeah, we don't have that. We don't have that study now, pay later. What will what will the usual requirements if the sponsor is from Canada? So usual requirement would be this just to show where the money is, right? So and how is your sponsor doing here in Canada, right? So is your sponsor employed and all of those things? So employed, bank statement. So yeah, so just to prove that your sponsor is really able to sponsor you. It's really a big help on my side if study in Canada to support my family, my children, school need as well. My money is not enough. Sorry. Thank you. Okay, I'll just go to the Q&A. Is it not a downgrade, sir, if we would like to study HCA if we are RNs here? So it is not a downgrade, right? I mean, like, it is, I mean, like, the way we tackled this one is the education that you'll get from Stenberg can be credited to, it's kind of like you can go in any other country and hold that certificate from Stenberg and they would kind of like accept it. But then if you graduate from the Philippines, unfortunately, even if you're a nurse, if you graduate as a nurse, that one doesn't hold any bearing, right? I mean, like you still need to take a lot of things before they would recognize it. While in Stenberg, your course, whatever course you take in Stenberg, that would be they would recognize that one. Do you have any other things to add on that one, Ma'am Jenica?
For Sheena, I would suggest that if you are already qualified for the postgraduate diploma in Canadian nursing, I think the first thing that you need to think about is what's your goal? Do you really want to be an RN or do you want to be a healthcare aide? Because if you qualify for the postgraduate diploma in Canadian nursing in the first place, I would recommend you that program simply because it has a direct access to becoming an RN. And if you already qualify for that, then I would say that you go for that since it will meet your goal of becoming an RN in Canada. But if you're just going to tell me that no, Jenica, I just do not want that type of responsibility anymore, but I still want to be part of the medical industry, then you can go ahead and study HCA. I guess it really depends on what your goal is, what you really want to become as your profession. And then that's where you think about whether you want to study HCA only or the postgraduate diploma in Canadian nursing. Because again, as Sir Israel said, this is an international qualification. Your qualification in the Philippines will hold no, weight on any other international level. So this international qualification, it will hold weight whether you go to the UK, you go to the US, to Australia, and especially of course in Canada. So that is how we will be positioning your application. So I guess that the Roman and Associates team will be able to assist you further when it comes to study statements. I think that's where your concern is. So that's it. Thank you.
Thank you. Do you offer other programs like AIPP program? Unfortunately, if this question is for Roman and Associates, no, we don't offer the AIPP. That one, I mean, like, yeah, there's a lot of misconception on the AIPP. So, but if you have any other further questions on the AIPP program, just go ahead and directly message us. We'll happy to answer your questions with regards to that program. Bottom line is for the AIPP program, you need to have an employer to sponsor you. So next question is, hi there, just listen to the webinar for healthcare assistant for Stenberg. Thank you. May I ask, what can you advise to me to do since I'm just high school graduate? Is it okay if I will just get the NC2 caregiver course here for 6 months? Then can I be qualified to enroll, or I really have to study 2 years course of college here?
I think our anonymous attendee need to clarify what high school you mean. Were you from the old curriculum or from the new curriculum? Because if you're coming from the new curriculum, then you're a K-12 graduate, then that's high school, then you qualify. But if you're coming from the old curriculum wherein we completed up to grade 10 basically, and then have to do 4 years of college, no, your NC2 will not be enough. You have to have an additional 2 years because what we're looking at is the again, year 12 equivalency. It's just the Philippines, I think, we're one of those that were late to update our education system into a K-12 system. So you have to be on that level of education, year 12 equivalency.
Okay. Do you have a fly now, pay later, any financial assistance such as a loan? Unfortunately, no, we don't have this one. But our other clients, they do ask their banks, right? Their own personal banks. They apply for personal loans from the bank that they bank with. So yeah, so if you pay the initial payment, what will be the process on the remaining fee, ma'am?
Okay, so if you pay the initial deposit payment, let's say you did it now and then we enrolled you and then you got approved of your visa for October intake, then your next payment due date would be when you arrive. You'll be given a couple of months after your program starts, and then your installment payment will apply. So it's commonly it's per quarter payment for the rest of the balance. Again, we're quite flexible with it. So if you need to personalize or customize the payment plan according to a date that will suit you, or maybe you want it done monthly on a particular amount, we can also do that. But as a standard a standard payment plan is a per quarter payment plan.
Perfect. Good day. I'm an engineering graduate. Can I take the HCA program? So generally, the answer for that one is yes. You can. I mean, it's how we would be presenting your statement to the immigration officer, right? I mean, like people can change their course from shift from HRM to nursing, or from accounting to nursing, or nursing to engineering, right? So it's just a matter of how do we present your case to the immigration officer. But generally speaking, yes, you can. Anyone can take the eight. I mean, like as long as you're qualified, yes. But it doesn't mean that if you're engineering graduate, you cannot take the HCA. Yes, you can. So, is HCA only for nursing graduate? No, that would be a no. I mean, it makes sense if nursing program and an HCA, they're both in the same healthcare field. But no, I mean, again, if you're a high school graduate, K1 to 12, yes, you can go ahead and take that one. Or if you graduate from a different course, you can still take that one, right? And again, it would be a matter of how do we explain it to the officer, like, hey, why are you shifting, right? And people have the right to change their mind. So yeah. Do we have to pay the full tuition? I guess this one was already answered by Mom Jenica. Thank you. All right. Let's go shift to the chat box if there's anything else in the chat box. And then if not, I think we can. I just don't know where we left off.
I think that the next question was, hello sir, how are you going to apply our visa since you're in Canada?
Oh, yes. So yeah, so that is a great question. We, I mean, we are able to apply for your study permit. I mean, it would be an online application. So we will be communicating via Skype, Zoom, emails, phone, WhatsApp, all of the technology out there. We can use that one. By the end of the day, it would be we would submit your application to online submission. So that won't be a problem at all. Right. So yeah. Is there any age limit? And generally, there's no age limit. So if you look at the if we look at the immigration policy under the for the study permit, it doesn't show anywhere in the policy that for study permit it would only be from this age to this age, right? So if need show money, yes, and show money would be the living expense, just to show, just to prove that you are able to survive. I mean, like survive here while you're studying, right? So, and again, the show money in the immigration website, it would say 12,000, but we would advise 14 to 15,000. We don't want to be just at that minimum, right? So yeah. How about if we have long gap experience, can we still apply for and enroll in the program? So let us just go ahead and submit your resume to us on that one. So again, it's assessment@romancis.ca. Then we will go ahead and take a look at your resume closely and then give you the options. What are your options based on your situation? It's possible money we pay on your office. We use the first as show money. Please, thank you. Or before, no age limit, please.
I think,
Yeah,
Sir
go ahead.
Israel, I just want to add, because I think Rosal is really keen to
Mm-hmm.
study but do not have the funds for it. Unfortunately, the school or the agent will not be able to assist you with that. I do know some third parties that can support your studies. You might want to check out DOST, ADB, Asia Development Bank. So you have to look at third parties. They do scholarships for vocational education, because this is considered a vocational education, right? So they will do 100% scholarship for certificate programs, undergraduate programs. I think that's where you should be looking at to support you with funds, because if you plan to study, you have to shell out money. That's just the way it is. You really have to have money to show the Canadian government that you can live there for a year, that you can support your studies. So I think you need to look at those options. So please check out ABB, DOST, they have a scholarship there. I hope that helps you. Thank you.
Thank you, Ma'am Jenica. So last question is, how about the visa application? Do we have to submit it personally to the embassy? No, you don't have to. That's where we come in, right? So we would collect all of the documents necessary, all of the requirements, and then we will be acting on your behalf as your consultant. So yeah, so no need to personally submit your, you won't be doing that one. We will do that one for you. You're welcome, Russell. And I guess that's it. Unless you are seeing anything else, Mom Jenica.
There is there are two questions on the Q&A portion.
Oh, okay. I'm just. All right, there you go. Okay. Hi, I am a registered nurse. Do you have partner at school in Toronto? Can you be able to send me detailed procedure or steps or even timeline of student permit application together with a fee? Sorry, I just joined in the meeting minutes ago. Unfortunately, I missed the earlier discussion. So Carmela, so Ma'am Jenica, is there any Stenberg in Toronto? No, right?
No, we only have
Yeah,
our
here
campus.
in
Yes, in
yeah,
Surrey.
and and that is perfectly fine, Carmela. I mean, like what other students do is they take the course here in BC, and it doesn't mean that if you take the course here in BC, you're stuck here in BC, right? I mean, like once you've taken your course here in BC with the international certificate that you have from Stenberg, you can go anywhere in Canada to work or live, right? So yeah, so that won't be a problem. Your advantage on that one though is that Toronto would have a higher cost of living than BC. So yeah, so that's your advantage of like coming here in BC, and it's a I think it's a better environment, climate, and all of those things. So yeah. And for the rest of the this video, I mean, like this webinar is recorded as well. So sorry that you missed the webinar, but you can go back to our you can go to our Facebook page and then search for the recording or the video, and it will be there. And then once you have watched it and you still have some questions, we're happy to answer those questions. Just message us in our FB Messenger, please. And how much is the show money? So it would be, again, the immigration website, it does say 12,000, but we would prefer 14 to 15,000 just to play safe, right? So yeah. Okay, I guess that's it. Okay. So again, once again, Janica, thank you so much. I'm pretty sure all of our attendees, there were like 40, 50 attendees. I'm pretty sure they have learned a lot of things. For those people who have any other questions, I mean, like later on, don't hesitate to ask those questions. Just leave us a message on our Facebook Messenger. And please, if you are interested, please do not hesitate to submit your resume to assessment@romancis.ca. And with that, once again, Ma'am Jenica, thank you.
Thank
Thank
you
you,
so
everyone.
much.
And yeah, so we'll keep in touch.
Thank you, everyone. Have a great afternoon. Good evening sa'yo, sir. Thank you.
Yep.
Bye.